Hello, and welcome to this week's medical news update. Recent research is showing us that metabolic health, how our bodies handle weight, blood pressure, and blood sugar, affects far more than most people realize. A new study published in the Journal of Clinical Endocrinology and Metabolism found that carrying extra weight and having high blood pressure don't just go along with dementia, they may actually help cause it. Researchers used a clever genetic approach that works a bit like a natural experiment to separate cause from coincidence. They looked at large populations in Denmark and the United Kingdom and found that higher body weight directly increases the risk of vascular dementia, a type of dementia caused by poor blood flow to the brain. Much of that risk comes down to high blood pressure damaging blood vessels over many years. The message here is straightforward. Managing your weight and blood pressure earlier in life could genuinely protect your brain down the road. In related news, how we define obesity may be changing, and the numbers are striking. For decades, doctors have relied mainly on BMI, a simple calculation based on height and weight. But a large study published in JAMA Network open applied a newer definition that also looks at where your body stores fat, using measurements like waist size and waist to hip ratio. When those measures were included, the percentage of us adults who qualify as having obesity jumped from about 40% to nearly 70%. That matters because many of the people who were newly captured by this broader definition also turned out to have higher risks of diabetes and heart disease, even though their weight alone looked fine. The bottom line is that where fat sits on your body may be just as important as how much you weigh. Meanwhile, scientists are uncovering new details about how different types of fat affect our hearts. Not all body fat is the same. There is a special kind called beige fat that burns energy and generates heat, unlike regular white fat that just stores calories. A study published in the journal Science found that in mice, beige fat helps keep blood vessels relaxed and flexible. When researchers removed beige fat from otherwise healthy mice, those animals developed stiff arteries and high blood pressure. The team pinpointed a specific enzyme responsible for the damage. When they blocked that enzyme, blood pressure returned to normal. People with certain genetic traits linked to less of this energy burning fat also tend to have higher blood pressure. This is still early stage research, but it could eventually lead to new, more targeted treatments for high blood pressure. Blood sugar is getting fresh attention too, specifically what happens after you eat. A study published in the journal Diabetes, Obesity and Metabolism looked at genetic data from more than 350,000 adults and found that people whose blood sugar tends to spike higher after meals had a significantly greater risk of developing Alzheimer's disease. Surprisingly, the usual markers doctors look at, like fasting blood sugar and insulin resistance, did not show the same link. The exact reason is still being worked out. Brain scans did not reveal obvious damage, so something more subtle seems to be going on. Scientists suspect that repeated sugar spikes may quietly promote inflammation in the brain, but more research is needed to confirm that. What you can do now is focus on keeping your blood sugar steady after meals through balanced eating, regular movement, and limiting processed sugars and refined carbohydrates. And speaking of movement, a new study in the Journal of the American Heart Association has good news for people who find intense exercise difficult. Researchers followed more than 7,000 adults who had a combination of risk factors for heart disease, kidney disease, and diabetes. They found that just 1 extra hour a day of light activity, things like walking around the house, doing light chores, or a gentle stroll, was linked to a 14 to 20% lower risk of early death over 14 years. You do not have to run a marathon or hit the gym hard. Simply spending less time sitting and more time moving at whatever pace feels comfortable made a real difference, especially for people who were already at higher risk. Taken together, these studies paint a clear picture. Our weight, blood pressure, and blood sugar are all deeply connected, and they do not just affect our hearts. They affect our brains, our blood vessels, and our long-term quality of life. The practical steps are things most of us already know, but that are worth repeating. Keep an eye on your weight and blood pressure, stay active in whatever way works for you, and pay attention to keeping blood sugar steady, especially after meals. Small, consistent habits really do add up. That is it for this week's update. I will be back next time with more research you can actually use. Take care of yourselves.